This segment of AM Northwest is brought to you by Family Matters.
Health and education, safety, and the quality of life. KATU and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because KATU and Providence Health and Services know that family matters.
Welcome back to AM Northwest. Cardiovascular disease is the most common underlying health condition for those who contract COVID-19. That's according to the American Heart Association. Here to share a little about COVID-related stress and its impact on women's heart health, we welcome from Providence Cancer Institute cardiologist Lori Tam, along with clinical psychologist at Providence, Kit Slies. Good morning, doctors. Good morning to the two of you. Dr. Tam, though, let me start with you. I think people might be surprised to find out that heart disease is the leading cause of death among men and women in the U.S., right?
That's true. You know, for most of the past 30 years, actually more women than men have died each year from heart disease. In fact, heart disease takes more lives than all types of cancers combined.
But it's preventable.
That's true. And about 80% of patients, heart disease is preventable by how we live, by exercising, modifying our diet, and managing stress. And in these COVID times, it's really important for us to be in our best physical shape, because we know that patients who have heart disease who contract COVID are much more likely to have severe outcomes.
Yeah. Dr. Slies, could this year be any more stressful? I mean, if you want to talk about stressful years, this one, 2020, and this continues now, this pandemic year, is so stressful. It's added a lot of roadblocks for people, hasn't it?
Yes, in addition to the just unprecedented levels of stress, our normal prevention techniques and coping techniques, things like going to the gym and getting exercise. Lots of gyms are closed, people not wanting to get outdoors to exercise. And then people reaching for things that are comforting, like unhealthy foods, alcohol, things like that, that aren't going to be the most helpful coping tools or prevention strategies.
Yeah, for sure. Dr. Tam, how much damage can stress do to your heart?
Well, excessive stress can raise blood pressure. It also increases your risk for certain types of heart attacks. In fact, there's a type of heart failure called stress cardiomyopathy, which is due to excessive stress on the heart.
Wow. Dr. Slice, so what kind of tips do you offer people out there who can, if we can try to lower the stress level a bit?
Yeah, when we think about stress, really our nervous system is in that overdrive. And so we want to equip our body and calm the mind. Equip your body with healthy foods, exercise, even if it's just walking, limit alcohol and caffeine, and then equip your mind. Make sure that you are breathing, meditating, stretching, whatever that might be for you. And then really just talking to people that you trust, that you care about. Telling them when you're stressed out is a great way to reduce stress. And to also remember that we need some stress to be motivated and to be healthy. So some stress is good, and that can take away some of the fear of the stress itself.
Well, that makes sense. So Dr. Tam, stress untreated can lead to anxiety. And how does anxiety affect the heart?
Well, you know, anxiety increases the levels of stress hormones like adrenaline and cortisol. It raises blood pressure, increases heart rhythm issues, and puts you at increased cardiac risk overall.
Dr. Slice, how can you tell the difference then between stress and anxiety?
So both of those are normal to a degree, and the symptoms may overlap. The biggest difference is that with stress, there's a clear external stressor. And once that stressor is gone, the symptoms of stress may go away. With anxiety, there's a lot of fear and worry involved. There may not be a clear external stressor. If there is, we tend to blow it out of proportion in our minds. Sometimes that external stressor is the worry that we have in our minds that sort of perceives that threat that we create. And anxiety just tends to be more intense and more involved with fear and worry.
Yeah. And Dr. Tam, moving on now to depression, how does depression affect a person's heart?
Well, you know, depression makes it hard for us to do the things that we need to take care of our body. So
Right.
examples include drinking too much alcohol, not sleeping well, not exercising, not watching what we eat. It's really lacking the motivation to take care of ourselves. So when all of these things happen, it's ultimately bad for our hearts.
All right. And depression isn't, Dr. Slice, depression isn't always something that you can recognize in yourself. You can probably see it in others, but you probably can't see it in yourself.
Sometimes we can recognize it in ourselves if we're feeling depressed, but there's lots of things that come along with depression, like losing interest in activities, socially withdrawing, having a hard time concentrating or making decisions, noticing just a big increase in negative thinking. Another big one that people don't always think about is that depression can be very physical too. We can have body aches, headaches, stomach upset, especially in little kiddos.
Yeah.
Sometimes it presents that way. And irritability is another thing that can sometimes come with depression. So those are some things to look out for.
Okay, well, we want to tell folks Providence Heart Institute is holding a talk just for women on stress and cardiovascular disease this coming Tuesday, February 2nd at 5:30. They'll also discuss meditation, which can help with anxiety, stress, and depression. It's free, but you'll need to register. We'll have all the links with more information on our website at KATU.com. Doctors, thank you both very much.
Thank you.
Thank you.
And we'll be right back with more AM Northwest. Don't go away.